Okay, folks, it's 2:02. We'll begin the call. What we'll do is, Caroline, I'll defer to you in a second to see if you want to give some opening remarks, and then I'll navigate us through the slide deck, and then I will ensure that we have plenty of time to have a Q&A session with Dr. Welch from the Office of Public Health, who's been gracious enough to provide us time this afternoon for questions and answers. So before we jump in, Caroline Roma, would you like to give a few opening remarks?
Thank you, Ken. I will be very brief. Welcome, everyone. We normally come together on Friday, what I call Yay Day. So happy, what is today? In COVID land, I never even know the day anymore, Tuesday. I want to give a shout out to two of my 150 plus bosses that I work for, Rhonda Aloise at KIP and Sharon Clark at Sophie B. They pushed me on, or I shouldn't say push, they asked that maybe I try to convene a meeting in which charter schools around the state could hear directly from LDOE and the health experts on the guidance. This is a space meant just for charters, so you feel kind of safe in your space to ask the questions that maybe are more specific to the needs of charters. And then another shout out both to Hannah and Ken for not only responding immediately to me, but setting this whole thing up. So I hope everybody finds it helpful. Put your questions out there for us. And again, Ken and Hannah, thank you so much. And I will go on mute for the rest of the call.
Thank you, Caroline. Okay, I'll go ahead and get started. Just a little bit of housekeeping prior to going on. So we are recording this session today, so we'll make that available as needed afterwards. Caroline, should anyone want access to this. The other thing is we will take questions. What I'm going to do is go through the presentation. I'm going to hit the high points in the presentation, and then we will open it up to Q&A with Dr. Welch from the Office of Public Health, who has joined us. So with that, let's move forward. I think what's most important, and several of you have, some of you have been part of this process. I know Miss Roma, Miss Romer. I saw Miss Johnson, Linda Johnson on here on the call today as well on the Zoom session. But just developing these resources, especially this 20-page school reopening guidelines and resource document that we released on June 25th. It started with Miss Sandy Holloway, our Bessie Board president, and myself in early May. We started participating in the Southern Regional Education Board Reopening Task Force. This is a group of 16 states here in the Southern region. We are on a call. We were on a call every Thursday afternoon, sharing what each other states were doing as all states move through the process to release their guidelines. We also had consultation with a superintendent's advisory group that met several times to give us their input and let us know what the key things were that they were seeking in the guidance. Pardon me, I'm sorry, that's my phone. Okay. We also worked with a 20-member public health response team, culminating in final approval by our state public health officers. And then this guidance went through the Governor's Resilient Louisiana Commission structure, which included the K-12 subgroup, which Ms. Johnson and Ms. Romer were both part of. And then it was adopted by the Resilient Louisiana Commission's Education and Workforce Development Task Force. And finally, there was a Senate education hearing on the guidance as well 2 Thursdays ago. So let's talk about what resources we have released. The first is our set of guidelines. This is the 20-page document. I'll ask if one of my colleagues, Meredith or Nicole or Hannah, who are on the call, if you could put the link to this in the chat. But this is a 20-page set of guidelines. It has a table, page 5, which really outlines the key things that are necessary for reopening school. It has best practices in here. It outlines things such as feeding structures in school, food and nutrition for students eating their lunches. There's a planning template that is in here for school systems to design and develop a reopening, and also a checklist. And finally, we have an FAQ, a dynamic frequently asked questions document that we keep on our website. Meredith McGovern manages that for us. As an example, we just had a town hall meeting, virtual town hall meeting with Children's Hospital New Orleans. As those questions come in and we start to notice trends in questions, we will codify those in our FAQ document. I should also note that relative to this 20-page guideline document, there was legislation towards the end of the session, House Bill 59, which asked for the state board, Bessie, to convene prior to July the 15th and adopt the critical items as requirements. And so that is moving forward. There will be a special called Bessie meeting that will be scheduled prior to July 15th. And what you could do is just, if you look in our document on page 5, where it talks about the maximum size of a group, symptom monitoring for temperature checks upon entry to the school, bus capacity, phase 3, 75%. These will be things that will transition to being requirements as opposed to just standalone guidelines, should they be adopted by our Bessie board pursuant to what was requested in Act 59. We do have supports from key partners. Children's Hospital of New Orleans has set up a hotline for school wellness and virtual care. This hotline is operated from 7 a.m. to 11 p.m. Weekdays, and then Saturday and Sunday from 8 a.m. to 8 p.m. This will give school systems this opportunity to call and get questions answered from skilled medical professionals, school nurses, etc., and get that guidance. There is also a town hall series. We just finished our first one today. We had almost 250 individuals participate in this. Dr. Finger from Children's Hospital of New Orleans answered several questions that people had. Just today's call was generally about overall COVID, the response to COVID-19. What is forthcoming is every 2 weeks we'll have another one, and they'll get more focused. There may be a special one around janitorial, an additional one around athletics and extracurriculars, etc. So they'll get more focused as we move on, and these will occur in July and August. And then finally is our regional public health officers, regional medical directors. They provide district level support for medical isolation, quarantine, and school closure questions and decisions. Questions for an outreach to the regional medical directors should go through the superintendent or his or her designee. There should be a single point of contact, so multiple teachers, multiple principals in your traditional school system, they're working through the superintendent, so there's a designated point of contact. 3 key principles: wash hands often, wear a face covering, and practice social distancing. These are the 3 key principles. If I were to be putting signs up in school, these would be the reminder signs that we would want up in the hallways, on billboards, in classrooms, etc.
Go.
Okay, let's go to our next slide, Meredith. Group sizes. The maximum group sizes, phase 1, 10, including the adults, phase 2, 25, including adults, and phase 3, 50, including adults. Younger students should be maintained in static groups. Older students should be, because we know the older students, unlike an elementary student, they transition from class to class. So you may be in your Algebra 1 class, period 1, the bell rings, there's a transition now, and you're going to a class with a different set of 25 students for English 2. So there should be physical distancing of 6 feet to the maximum extent possible. And I'm sure Dr. Welch will, I'm gonna actually ask him when we get to the Q&A session to talk a little bit more about distinguishing between the static groups and the maintaining the physical distance of 6 feet. The physical, this page here, we talk about the physical standards. We talk about in large spaces such as the gymnasium or cafeteria, more than one group can convene if there is a wall or partition erected. High touch surfaces are cleaned before and after each group's use. We're working on actually having a definition for that as we move towards these becoming requirements. Groups are separated outdoors but do not require a physical barrier. Limit crowding at entry and exit points, maintaining maximum group sizes and physical distance recommendations to the maximum extent possible. Athletics. Phase 1 and Phase 2 should be refraining from contact in high-risk sports, such as like football, that is volleyball, wrestling. Those should be refrained of. Those are contact sports. Those would be allowed in defined groups with certain conditions in Phase 3. Symptom monitoring. The biggest takeaway, you need to know with symptom monitoring is that there is to be a temperature check of students in the morning upon school arrival. Again, this will be something Dr. Welch will speak to. It could occur also in the homeroom, but there are to be temperature checks in the morning, screening for that 100.4 or higher. Environmental cleaning, high touch surfaces like your doorknobs, bathroom faucet handles, etc. Clean multiple times throughout the day. Hand washing, at least every 2 hours, before and after eating, before and after using outdoor play equipment, and at exit. Adults and students. I'm going to try to be very clear here because this is probably the number one question we have gotten is about the face coverings. All adults on the school campus should have a face covering. Every third grader and above should have a face covering. There will be medical exceptions. There may even be instructional exceptions. For instance, if a student has a speech impediment and that student is getting speech therapy services, that mask may need to be pulled down, to get the proper speech therapy with, of course, physical distancing in place. But the expectation is every adult on the campus and every student in grades 3 or higher are wearing cloth face coverings. Transportation. We have Phase 1 transportation. Should the state toggle back or local community toggle back to a Phase 1, bus capacity would be at 25% of the manufacturer's specifications, with one seat empty between each other. Members of the same household can sit in the same seat or adjacent seats. For Phase 2, which is the phase we're in right now, bus capacity would be at 50% of the manufacturer's capacity. This would be the maximum number of people allowed on a bus at any given time. Passengers should be spaced and dispersed to the maximum extent possible. And when there's a transition to Phase 3, the total amount of individuals on that bus could increase to 75% of the bus manufacturer's capacity. Okay. We have gone through the presentation. I think what I'm going to do now is open this up to the Q&A. I would ask that you send your questions in to the host. So please send those in if you have questions. At this time, Dr. Welch, if you're on, I'm going to ask you to please announce yourself, do some introductory remarks, give us an update on what you know as of today, where we are with COVID, and then we'll start the Q&A session.
Excellent, Ken. Can you hear me?
Yes, sir.
Excellent. Excellent. It's nice to be with you all today. My name is Dr. Frank Welch, and I am the Medical Director for the Bureau for Community Preparedness in the Office of Public Health. And I have worked on coronavirus since this past January, preparing all different sectors, the hospitals, nursing homes, the business community, and the educational community as well. I know the statistics are quite sobering, but I'd like to remind you all of them. In Louisiana, we have almost 70,000 confirmed cases of coronavirus. But as you all know, at the beginning of coronavirus, we were only testing very ill people. So that 70,000 positive tests in Louisiana is surely an underestimate of how many people actually had it. Unfortunately, there have been more than 3,200 deaths in Louisiana in just the 4 months since this has come into being. And currently, the situation is actually quite serious. The number of tests is about the same, whereas the number of positive cases are increasing, whereas the number of hospitalizations are increasing as well. We have more than 1,020 people currently hospitalized in the state of Louisiana for coronavirus. So this is still very, very serious, and unfortunately, over the past 3 or 4 weeks, getting worse. As Ken mentioned, we are in phase 2, but we have learned a few things over the past 4 months, which I think is important to school reopening, but also reopening and moving to the next phase. I think we all are coming to understand that just ignoring it and hoping it'll go away is not the way to successfully beat this thing. It is to follow some simple rules, and by doing that, we can all move forward. The things we've learned about the virus is just how contagious it is. This is an extraordinarily contagious virus, passed by droplets, which means you really do need to be within 6 feet of someone for more than about 10 or 15 minutes. We also have learned, unfortunately, that there are a lot of asymptomatic carriers. This has a range of illness, all the way from someone doesn't even know they're sick or think they may have a mild case of hay fever, all the way through they have a fever and have to stay home, all the way through need to go to the doctor, go to the hospital, be admitted to the hospital for oxygen, be admitted to an intensive care bed, or then even pass away from it. Unfortunately, this wide range of illnesses. Children, fortunately, are less severely affected than adults are overall. However, you all have seen the news. Children are affected, and especially younger children. There is a vascular disease that's coming into being, and we just don't know what role children play in passing the disease to each other and then bringing it home to their families and possible more vulnerable family members. So again, it is important to focus on children and prevention in children, because we don't want them taking coronavirus home and spreading it to those who are more vulnerable. So that leads us kind of to those simple rules that Ken talked about earlier. That is what the entire guidance is based on. And it's what we know in the previous 4 months that we really know can slow down coronavirus, keep it manageable. And then again, I like to remind people, this is just temporary. When we hopefully find an effective vaccine, when we find effective treatments, these things are going to slow down, and hopefully we can move to phase 3 and phase 4. What we're trying to do is slow the tide right now so that we can keep up with the infection rate, keep infections down, save lives, and then when these other interventions come into being, we can move on to a more normal life. So these things that we're proposing are just temporary, and those are really simple. Stay home if you're sick. That's the first rule. That goes for students, teachers, everyone. The second one is that physical distancing is important. The best thing you can do is stay 6 feet away from other people. Masks are effective. Sometimes we get a question. Masks are not great at preventing the wearer from getting coronavirus. However, they are effective in preventing a person with asymptomatic or mildly symptomatic coronavirus from spreading it to other people. And places where they have widespread mask use have a much lower rate of transmission than other places. So we do know that they work. Wash your hands frequently, and then frequent environmental cleaning. Those kind of 5 simple rules are what's going to get us forward, and that's what the guidance is based on. Ken?
Thank you, Dr. Welch. We'll jump right into our questions, and I'll give you a break real quick, and I'll answer the first one for us, and that was about vulnerable staff returning to school or who may be hesitant to returning to school. I would just note that on page 9 of the guidance that we released, which I saw Hannah Deitch actually posted up here in the chat box, we do reference that schools and employees should continue to work closely with legal counsel to determine rights and responsibilities as this area becomes clearer in the months ahead. So I would say that we do reference in there that you should be working closely with your legal counsel on that. That should be done locally. The next thing, Dr. Welch, is there seems to be some folks that just want some clarity on number one. Can you define for folks what it means to be quote unquote exposed, and then the follow up for that, define what it means to be infectious. So exposed and
absolutely. Yeah, Ken, and thanks for that. And we've gotten this question multiple times before. And it kind of makes sense if I walk through it with you. If you say, for example, if I have coronavirus and I'm sitting next to someone and they're very close to me, for 10 or 15 minutes and we have lunch, right? And that virus passage from me and that person either gets it on their hands or somehow touches their face, that is how they are going to become infected with it. However, that virus doesn't go to, it slowly goes to work over the initial 3 to 4 days. So you can become infected with it, but then before you become contagious is when the virus has set up shop, it is set up in your throat, and you can infect other people. So there's a difference in the time between you are infected, which would be today, and the time you become contagious, which is 4 or 5 days from now. That's when you can spread it to others. So I hope that helps.
Thank you. There's a question about the temperature checks and how effective are temperature checks if somebody may be asymptomatic?
So that's a great question as well. And what I want you all to think of is all of these things we're talking about are a toolbox. And in this toolbox, we do the best to use the proper tools and the ones that are effective. And the more tools we can use, the better off we're going to be at preventing the spread of coronavirus. Temperature checks are just a single thing that we can use to help prevent coronavirus. That temperature of 100.4, if somebody has it, is pretty indicative that they're sick. Now, that doesn't necessarily mean they have coronavirus. We all know that the past two or 3 years in Louisiana, we've had pretty bad flu seasons as well. But what I want you to think about that temperature check is if somebody has a temperature of 100.4, we do want them separated and go home no matter what the reason is. It could be the flu, it could be coronavirus, but as the questioner mentions, temperature checks are better for indicating someone has coronavirus when they actually have the fever and are symptomatic. Temperature checks are mildly effective at seeing who has it and who doesn't have it. But again, what I want you to think of is that temperature check is just one tool that we're using. If someone has a temperature, we want to separate them, but that doesn't mean that someone with coronavirus who's asymptomatic won't continue on. That's why we have those other rules: physical distancing, wearing a mask, washing your hands, environmental cleaning.
The next question is about the face coverings, and I know it's come up a lot. We get it on every call, and that's the question about shields. And I think the reason it comes up a lot, Dr. Welch, is because I know very early on, like literally a day or two after the state's declaration was made and school facilities were closed, there was some early guidance around face shields, but I believe that guidance has changed now. So can you speak to the difference between the cloth face covering and a face shield?
Absolutely. And you all may know when you talk to your educational counterparts, there were several states about 2 or 3 weeks ago that were investigating cloth masks versus face shields for all school children. So this is been around. However, what they found is, and for any of you who don't know, when we're talking about a face shield, it looks like a hat. There's a band that goes right here and a plastic sheet that comes down that's usually see-through. And what they have found, and the CDC has recommended, face shields are not equivalent to a cloth mask. They're better than nothing, but they are not equivalent. And the reason is because you can imagine at the bottom of the face shield, there is a gap that allows air to freely transmit above and beyond. And since this disease is spread by little water droplets, it allows those water droplets to both get in and come out. I've all seen in the emergency room and doctors, they not only wear that face shield to protect their eyes, but they're also wearing a mask as well. So a simple cloth mask made of t-shirt grade material that is doubled up on itself is the best protection. That does stop a significant number of viral particles for those asymptomatic people from getting out. So currently, face shields are not as good as cloth masks.
Should the cloth masks, cloth face coverings be worn all day?
So I get this one a lot. So again, this is just our toolbox. And what I want you to remember is, especially to the greatest extent possible, wear that face mask. But every single person during the course of the day is going to have some event or something where they want to remove that face mask. And what I want people to think of is, if they do need to remove the face mask, the more you touch your hands and face and mask, the less good it is. However, you can always step 6 feet away from other people, remove your mask. It would even be better if you got to step outdoors, take a few minutes, be 6 feet away from each other. And then when you come back into these indoor environments, make sure your mask is on. So to the greatest extent possible, keep your mask on, especially when you're near other people.
Thank you. I promised early on I was going to pose this question, Dr. Watson. So I'm going to pose this one to you, and that is, can you share with the folks the static group for younger children, what that might look like for, let's say, a classroom of second graders, and then what it might look like for physical distancing to the 6 feet maximum extent possible for your older students?
And I'm actually going to answer that question the opposite way. And the reason for that is the way we have outlined the guidance and the way we understand this disease, it really is best to stay 6 feet away from other people. And that's why we have the guidance that we have for older students, but also because we know those older students are going to be migrating between rooms. You know, they may have a class with a certain number of students, but then the students are going to mix in the next classroom. So really, that wearing a mask, staying 6 feet apart from each other is kind of the gold standard of coronavirus prevention. However, we're all aware that, especially when you get into the lower grades and even daycare, it's going to be very, very difficult to keep very young children 6 feet apart from each other. So as an alternate strategy, not quite as good as the 6 foot away from each other, what we want to do is limit the number of children who come into contact with each other each day. So the static group is intended to keep just the same people together all day long and not mix a whole bunch of people together. And part of that is because if we do get a positive case of coronavirus, we may have to ask people to isolate and/or quarantine. And by limiting the group size of people who might have been closer than 6 feet for more than 10 or 15 minutes, we limit the number of people we have to ask to stay home. So it really is trying to limit the spread, if and when it happens, to a smaller group.
Thank you. The next question, Dr. Welch, is what happens when there is a positive case? And I think what I'm going to do is I'm going to actually read 3 quick paint by number items, as I refer to them, off the last page of our guidance, and then let you fill in the gaps. So I would say this relative to what we have put out. So again, the guidelines that were released June 25th, they're approximately 20 pages. The very last page is, what are the steps when a student in a school tests positive for COVID-19? And number 1 is, if a school becomes aware of a presumptive positive or positive case of COVID-19, the child should not attend until determined to be non-infectious by his or her physician. Number 2, parents may be notified by the Office of Public Health if their child may have been exposed to the case of COVID-19, along with any next steps. And number 3, if it's determined that a school was the focus of infection for COVID-19, the school superintendent, in consultation with the Office of Public Health, will determine if the school should remain open or close for a period of time. And then I think the last sentence is very important. I've heard it multiple times. I even heard it today on a White House briefing. But a positive case of COVID-19 does not necessarily warrant classroom or school closures. What else would you add, Dr. Welch, about when a student tests positive? What should schools be considering and doing?
Yeah, and I think that's really important what you said there, Ken. Again, the way this disease transmits is people who are closer than 6 feet with each other, and then they're interacting, physically touching, they're very close to each other, not wearing their masks, right? So the guidance we've given you all is intended to prevent disruption and prevent these kind of things from happening. You can imagine one scenario where, Ken, I gave this restaurant example the other day, where a restaurant worker did her entire shift that day. She wore a mask. The restaurant was outdoors. She briefly interacted with diners at the restaurant. And during that interaction, it was never 6 feet closer for more than 10 minutes. However, during that break time, she went back to the break room and with 2 other employees took off their masks and they smoked cigarettes and even passed a cigarette between them. So those brief interactions where you're wearing your mask and you're doing your prevention, those people don't need to quarantine. However, the 3 people who were in that small group who were not following those guidance did have to quarantine. So every situation is going to be different, but remember, by following the rules, that 6 feet apart from each other, wearing the mask, that's going to minimize the number of people who we have to contact and say, you need to stay home for 14 days and watch for symptoms. Now, the other part about that also is when we initially started coronavirus, there was, and people remember, we were closing down businesses for 14 days or for several days for deep cleans and everything like that. And what we've learned is that really routine daily cleaning and frequent cleaning of those surfaces that we touch a lot is perfectly adequate to prevent coronavirus transmission. So really, when we close down a school or ask people to stay home, it is going to be those exceptions where we feel that close contact has happened, not the whole school or the whole classroom.
Thank you, Dr. Welch. I'm going to take the next 2 questions because they're policy related on an academic side here at the department. The first one was, when do we expect what we currently have on page 5 in our table in the guidelines, which is like the maximum group sizes, the face coverings for 3rd grade and all adults, temperature checks, the transportation. When do we expect those to be adopted by BSEE? And again, the enabling legislation for that required that there be a BSEE meeting no later than, I believe it was July 15th. I believe they're tentatively trying to schedule that now, and that would be prior to July 15th. I believe it may be July 14th that they're working on that. So that would be it. They would be adopted under the provisions that were outlined in House Bill 59. So you could expect those by July 15th to be transitioned into policy, into requirements in lieu of just guidelines. The other question we get often, probably the second most popular question we get after the face coverings, is about instructional minutes. And so, I would just say that the current position on regulatory flexibilities right now, Superintendent Brumley has outlined this on page 3 of our guidance document. I'm just going to read it verbatim. At this time, current laws and policies relative to compulsory attendance, instructional minutes, and state assessments will remain in place. We will continually monitor the pandemic and address any necessary regulatory flexibilities at the appropriate time. Okay, those were 2 policy ones. Dr. Welch, I'm going to come back to you now. It was asked if you could give any guidance or suggestions for unstructured time, such as recess. What things should they be considering?
Yeah, what we want you to do, especially in that recess time, is first make sure you're maintaining that static group. It is totally fine for multiple groups to be outside, but they really do need to not interact with each other. If at all possible, you need to do activities that are not contact. Ken already mentioned that. Things like wrestling or things like that should be prohibited, and have children do individual activities or activities that don't have the children touching each other. Obviously, as Ken mentioned, we wanted children to wash their hands before and after coming in from the playground equipment. But again, maintain that static grouping, wash your hands before and after, and try and minimize contact between the students. And then we did have a question early on about the role of playground equipment. But another thing we have learned is with coronavirus, it really doesn't survive outside, especially in the sun and humidity, very long. So, you know, routine cleaning or even just the rain is going to pretty much wash coronavirus out. So you don't have to worry about playground equipment so much if you're having the kids wash their hands both before and after they play in the playground.
Thank you. I'm going to read this straight from the chat, so be patient with me. Do you have any advice on dealing with students who are frequent complainers that often complain of not feeling well in order to go home? How do we balance taking possible COVID-19 symptoms seriously with making sure these students aren't abusing our policies about presenting with symptoms in order to stay home from school?
You know, I think that is going to be a personal relationship between the school and the child and or the child's parents. I do recognize that that is going to happen at times. I don't think, you know, kids are smart. If they know what the symptoms are, they're going to complain of those exact symptoms. And again, in coronavirus prevention, we do want to be a little bit overly cautious. Unfortunately, just because a kid is a frequent complainer does not mean they're not going to get coronavirus. And I think at least at this time, I would be overly sensitive to that and, you know, isolate the kid just in case. But then again, I also would rely on those things that you do all the time for instruction when kids are not able to attend the classroom. Make sure you have those backup plans for instruction when a child is home. Make sure that they continue to have to do the same amount of work, whether they're at school or not at school, so that at least their educational process is not interrupted.
Thank you.
Close the door.
Yeah, I think also, Dr. Welch, that it sounds like this also would be a good opportunity for the school to leverage the Children's Hospital hotline, which is going to offer guidance to school nurses and administrators about medical questions pertaining to students. So, if, you know, they also
Absolutely.
They have that hotline that starts at 7 in the morning, goes till 11 at night, and on the weekends. And that was on slide 8 today. We've got this information in our guides and our resources. But yeah, definitely leverage the New Orleans hotline, Children's Hospital New Orleans hotline for this. Seems like that's exactly what it was stood up for, is to help have nurses available to help answer these medical questions pertaining to their students or team members. Next, Dr. Welch, is, you know, we keep emphasizing. I'm gonna come back to my guidebook. In, you know, I referenced later about what a great poster it would be in the school, but three key principles: wash hands often, wear the face covering, and practice social and physical distancing. With that, the question that has come in is, should people feel safe if they're in a school environment and people are doing what they're supposed to do, which is temperature check, isolate, and then wash hands, wear face coverings, and social distance? Should they feel safe?
So I'm going to go to, you know, what we've learned in the past 4 months. And we have learned that over the past 4 months that people who follow these rules get coronavirus, and coronavirus spreads significantly less than people who don't follow the rules. And unfortunately, what we're seeing across the United States, and unfortunately in Louisiana as well, is I think either people got tired or they misinterpreted this phased reopening as returning to normal. And what I want people to really understand is the way to move forward, the way to get through this is to follow the simple rules so that we can continue to reopen. It's when we forget those simple rules that things get out of control and we may have to take a step back, which we obviously don't want to do. So the best medical guidance I can give you is those simple rules, Ken. And I think part of the reason people ask is it seems so simple. Just wash your hands, stay 6 feet apart from each other, wear a cloth mask, ask sick people to stay home, and frequent environmental cleaning. It does seem kind of simple, but those really can prevent coronavirus from being widespread in our community. So I'm not sure that I could guarantee that by following these rules, no one is going to get coronavirus, but I certainly can tell you a whole lot less people will get coronavirus if we follow these rules.
Thank you. Transportation, back to transportation. What are some considerations for bus measures, such as like the windows and perhaps sanitizing, etc.?
Yeah, so this was a tough one, and this is kind of, Ken, where I announced it. I don't know if anyone else has been on my conference calls, but this is kind of where I understand and empathize with everyone who is on this call. The entire process of getting a kid from his house effectively and efficiently to a school safely with oversight, educating them in a controlled environment, and then getting them back home again. A lot of that is in contrast to what I'm asking you to do for coronavirus prevention. So I understand and empathize with that. Now, with the transportation guidance, what I want you to do first is take the bus capacity, divide it in half, and that's the number of students that can, and obviously the driver counts as well, that can be on the bus. And then I've been asked multiple times, well, how do you space them out? What you really want to do is, to the greatest extent possible, have students sit apart from each other. If your bus holds 50, don't have all 25 in the back, in the back seats. In addition to that, you can have family members sit together. I'm going to give you some other simple tips that are going to help as well. I want the bus, and this is already in the guidance, to be cleaned both before and after the run. I want the children to wear face masks. I want the driver to wear a face mask. I want the windows to be cracked to the greatest extent possible. And the reason we say that is there's going to be some days where you can't crack the windows. If it's pouring rain outside, you can't do that. But the more airflow we have, the less likely coronavirus is to spread. And then if at all possible, when you spread the kids out, if they can be doing quiet activities like reading or listening to music, that's better as well. So again, to the greatest extent possible, I want you to separate the kids, clean the bus before and after, have kids wear face masks, crack the windows, and that's the way we're going to transport kids as safely as possible.
Thank you. We have a question about the ventilation systems, and I would just note that on page 10 of our guidance document, we have a small section on ventilation. We have a small section on ventilation, but the question in the chat is, can the virus spread through ventilation systems?
So that's a tricky one. We don't know a ton about this virus, and there's not a lot of answers to that one. It is possible, though. There are some reports in China that where a single ventilation system was used in a multi-story apartment building, that there was some transmission that way. What I will tell you to everyone is that's certainly a minor mode of transmission. Coronavirus goes on little water droplets, and little water droplets tend to fall downwards and not go upwards into ventilation and travel large distances. So that may be a very minor mode of spread, but certainly that close personal contact is a much more major route of spread. So it might be a minor route of spread, not a major one.
Yeah, I was looking back in the guidance document, which we actually pulled down from Centers for Disease Control, which informed our guidance here, and that's that ensuring the ventilation systems operate properly and increase circulation of outdoor air as much as possible. For example, by opening windows and doors. But we also put in there that if a school's ventilation system fails, they should consult with their local health officials about the possible need for school closure. And I think that's a good example of when the regional medical directors should be consulted by that local school leadership or superintendent. Again, I still have some questions coming in about instructional minutes. So I'm going to come back to the instructional minutes. So, there are approximately, I believe it's 63,700 instructional minutes required annually. For high school credit courses, there's approximately 7,800 instructional minutes required for that student to earn the Carnegie credit. Those instructional minutes have not been waived. Now, however, calculating those minutes, if a student, for instance, let's say they were in close proximity, they were quarantined for the 14 days, and they were doing schoolwork remotely, what you're looking for as a school relative to those instructional minutes is, through live instruction, through recorded instruction, through assigned coursework, you're looking for that equitable amount of minutes, 7,800 or 63,720 worth of work that student is working on and completing for those instructional minutes. So I just want to emphasize again, instructional minutes, compulsory attendance, state assessments, they have not been waived for the next academic year. As Superintendent Brumley noted in his opening to the guidance, his letter in there, we will continually monitor the pandemic and will address any necessary regulatory flexibilities at the appropriate time. So those minutes are still in play. There's different ways to get those minutes, though, whether it's face-to-face, whether it's virtual or remote.
Hey, Ken, this is Caroline. If I may on that, I did have the opportunity to be with Superintendent Brumley just this morning, and that question came up very directly to him. He answered very similarly to what you just read, but he went on and just gave some examples that he certainly does recognize that some of the health measures and safety measures you'll be having to take as schools, such as temperature checks, washing hands, things like that it could impact the time you're spending doing that versus being in the classroom. So he's not sitting there not recognizing, as Ken said, things may come up that we learn as we go what may need to be addressed. But at this time, he said that there is nothing coming, for example, at the scheduled Bessie meeting in August. So again, he is monitoring, he is well aware of the challenges, but nothing at this time is planned.
Thank you, Caroline. Let's take a couple more questions. We're almost through all of them. The next question is about the quarantining process. If a student tested positive and another student had been in close proximity, which I believe is referenced in the guidelines as 6 feet or closer for 15 or more minutes. Dr. Welch, what could they expect relative to the quarantining of a student or a faculty member because of close contact?
Yeah, so currently, if and when a student, and I think we all need to plan the when, with the number of cases of coronavirus in Louisiana, this will happen and we need to expect it. But if a student is determined to have been coronavirus positive and at school when they were infectious, and they were within 6 feet of other people, say an instructor or other students, in either a static group or the students that possibly were around them, there will be an investigation and contact tracing. You all have heard about the contact tracing process within Louisiana. And if other students or possibly an instructor is determined to be a close contact of a case where we know they were infectious at the time they were in close contact with them, those people will be asked to stay home for 14 days and monitor for symptoms and keep in contact with their doctor for further guidance.
Thank you. Got a couple more questions still coming back in about the temperature check. So let me level set on that, and we'll kind of start over again on temperature checks just to make sure we're all aligned. So currently on page 5 in our reopening guidelines and resources, we have under symptom monitoring that assess students on arrival. That's right out the gate. That's what we talk about with symptom monitoring. There is an expectation that there is a temperature check for each student upon arrival at the school. And again, this is on the table on page 5, which is the table I referenced that as the House Bill 59, which I got a couple of texts with, that has now been signed by the governor, I believe. This will be one of the recommendations as a requirement. It will transition from being just guideline best practice to actual requirement. But Dr. Watts, can you also speak to kind of that broad term on arrival at school, and just I think you said it earlier today, but it'd just be good to hear again about how you have that opportunity to perhaps do this in the homeroom.
Yeah, and so this is going to be one of those things that is really a school-based policy. You're going to have to decide what is best, given all of these simple rules, what is going to be best for each school. For example, for a very small school, you may want to do it just on arrival. As students arrive, they stand 6 feet apart from each other, single file, and are just checked as they enter the school. However, for a very, very large school, a large high school or something like that, it's probably going to be much, much better if you efficiently get students into the building where it is cooler and organized, where they can get to their class. And then as they get to their initial homeroom, do it right there. So on arrival means the first convenient time as the students get to school. And what you don't want to do, though, let me give you an example of what you don't want to do, is if students are running or playing and then they rush over and they're standing in the sun, it probably wouldn't be worthwhile to take their temperature right then. You do want to do it after they've entered, or after or as they enter the building in a cool place. And then in addition to that, if you do find a student who does have a temperature of greater than 104, what we want you to do is physically separate that person for a few minutes, maybe 4 or 5 minutes, just in case they've been outside or running or in the sun or something like that, and then do a temperature recheck on them. And if they still have a temperature, that's when we want you to activate your isolation protocol at your school, where you physically take them to another room where their parents are called so that they can come be picked up.
Thank you. And I'll take this last question here for us, Dr. Welch. I'll let you actually respond to this one. But what, we have in the guidelines that it is actually, again, I'm going to come back to that very last page 20, that a positive case of COVID-19 does not necessarily warrant classroom or school closure. But what are the conditions where there may be a school closure? Like, and I'm sure you don't have a hard number or something to give on that, but what
Right.
things will be considered if there were to be something that required a school closure? And I know this has happened before with the flu. What things do public look for?
So I'm going to give you sort of the worst case scenario. And it is really if it is determined that there were multiple students who were actively infectious, who were in close contact with multiple other students in multiple classrooms and multiple grades and multiple buses, that's the time when they would recommend, we need to slow this thing down for a few minutes. Again, it is going to be on that case by case basis, finding out who was the case, and were they actually infectious while they were at school? And then what were they doing while they were at school? Were they wearing their mask? Were they 6 feet apart from each other? How much contact did they have with other people? And then what was that contact look like? Based on those factors, that's what's going to determine who gets quarantined, like whether a classroom may be shut down, maybe a bus or something like that. But again, it is going to be on a case-by-case basis, evaluated exactly what that person's infectious potential was and how many people they came into contact with. And then that disaster scenario where we have a whole bunch of students who are infectious all at the same time, who are not following the rules, that might prompt a school closure.
Thank you. Well, Dr. Welch, we're very gracious for your time. I know we're coming right up on the hour. I'll just give a couple of next steps, and then Caroline, I'll let you give some closing remarks. So just as a reminder, these guidelines, they're on our website. We update the best practices as aligned with Centers for Disease Control. We put stamp a date on the bottom left-hand corner, so you'll know when you're working from the most recent version. Today's webinar is recorded. We will work with Ms. Caroline on this to see what the best approach will be to get you access to this following it. Questions that came in today, many of these have already been answered. We've addressed them. Again, what I would recommend is that you look at our dynamic FAQs. Meredith McGovern on our team is keeping those updated. Questions today that got posed and answered, which we don't have on the FAQ, we will be sure to add those there. So Caroline, with 2 minutes left, I'll turn the floor over to you for closing remarks.
Thank you, Ken. Like Abraham Lincoln said, he's never heard a bad short speech. So I will be brief. Thank you again for doing this. As everyone heard, we'll get the recording out to you. LAPCS will also give you updates about the BESI meeting that will probably take place. Well, it will take place before the 15th. We'll make sure you're aware of that meeting. And we will also do follow-up to you regarding that meeting. And we will continue to get back on our Friday regular schedule of calls soon. So thank you, Ken. Thank you, Hannah. Thank you, Dr. Welsh. Appreciate your time on this. And that is all from LAPCS.